Testicular cancer affects young and middle-aged men more than other age groups. Dr. Thomas Walsh is a urologist at UW-Medicine.
Most testis cancers present with a solid, painless lump in the testicle. So it is identified through just a random self-physical exam. So the very first point at which a man or one of his loved ones identifies a lump on the testicle, he should see an expert. If you identify an abnormality, even in a really private, intimate part of your body, don't neglect it. Don't be embarrassed. Have it checked. It can be really disconcerting and something that we really just want to try to ignore, pretend it doesn't exist. Don't do that. And the reason is that testis cancer is imminently treatable.
He says testicular cancer is imminently treatable if caught early. We asked Dr. Walsh, how common is testicular cancer?
Even though it occurs at a rate of 1 in 250, the risk of dying of testis cancer is extremely low if it's detected early.
Testicular cancer tends to affect men at a younger age than other types of cancer.
The median average age for men with testis cancer is in their mid-30s, actually around age 33. What really differentiates this cancer is that it hits at men before they've started their family planning, and the actual treatment impacts their ability to have children in the future. Treatments are often really detrimental to a man's fertility. Number one, the primary treatment is to remove the testicle, thereby knocking down at least half of what a man's normal sperm production would be. But some men will go on and actually need to have other more systemic therapies like chemotherapy or radiation. And chemotherapy in almost every form is a pretty negative impactor of a man's fertility.
Specialty clinics like Men's Health Center at UW-Medicine Center offer a wide range of services for men.
The Men's Health Center really hits at those topics that are below the belt, that really deal with intimacy, like sexual function, testis cancer, infertility, genital pain syndromes, low testosterone. One of the things that we've done is we've set up a UW-Medicine Men's Health Fertility Preservation Fund, and we are actively working to promote donors and philanthropists to help us assure that we can provide fertility preservation services for all men in need.
Cases of testicular cancer have been steadily rising for decades. Dr. Walsh offers insights about environmental risk factors and why this may be playing a role in the increasing incidence of testicular cancer.
If you look at industrialized Western countries across the world who track testicular cancer rates, we've tended to see a significant rise in case numbers of testis cancer year after year. There are a lot of hypotheses around this, but nothing absolutely definitive. And the hypotheses really speak to our changing environment. My father didn't drink nearly as much out of a plastic bottle as I do in this era. And the question is, are we more exposed to these things that may be a nidus for cancer than generations before us were? And these theories are just theories, but certainly we can get behind them and think that there probably is some reality here.
MD Network further investigated this topic. Testicular cancer is the most common cancer in men aged 15 to 34 years. According to the American Urology Association and the National Institute of Cancer, there is no standard or routine screening test for testicular cancer. Most often, testicular cancer is found by chance during self-exam or a routine physical exam by a healthcare provider. Screening tests must demonstrate clear benefits that outweigh their risks and costs. Screening tests for testicular cancer are being studied in clinical trials.